Hi everyone, my name is Ashley Santora. I am a student here at Regis College in the Pediatric Nurse Practitioner program. We are here today to discuss week 13, which is the treatment of otitis media in a 17-year-old female. So our patient is Emily Johnson. She's 17 years old, diagnosed with otitis media. She presented to the office with complaints of ear pain, decreased hearing in her right ear, and a low-grade fever for 3 days. Emily reports experiencing similar symptoms in the past, but has not had an ear infection in the last year. She denies any recent upper respiratory infection or trauma to the ear. There's no history of allergies or significant medical history. Emily is otherwise healthy with no significant medical history. Based off of Emily's assessment, our first line pharmacological treatment for Emily is amoxicillin, an oral antibiotic. Amoxicillin is an aminopenicillin in the beta-lactam class of penicillin antibiotics. The mechanism of action is it works by binding to penicillin binding proteins, PBPs, which block the final step of bacterial cell wall synthesis. By preventing the cross-linking of the peptidoglycan, the bacteria cell wall becomes strengthened and becomes weakened and unstable. The bacteria are then unable to maintain their structural integrity, leading to the cell lysase and death through action of the bacteria's own autolytic enzymes, which is the goal. The pharmacokinetics, it absorbs rapidly. You can take the medication with or without food. It distributes evenly and effectively through the body into a wide range of tissue and bodily fluid, including the middle ear, which is where we're going to be focusing on, sinuses, lungs, liver, bone, muscle, gallbladder, and more. Elimination is through the renal system, mostly through the urine. Half-life is around 1 hour for adults. The pharmacodynamics is it exhibits time-dependent bactericidal activity. Its clinical effectiveness is associated with maintaining free drug concentrations above the pathogen's minimum inhibitory concentration for at least 40 to 50% of the dosing interval, which maximizes bacterial killing. The second line treatment would be amoxicillin covalente, which is augmentin. And this works, the amoxicillin part works the same way that we just talked about with the aminopenicillin and the beta-lactam class. And the Clevalente is the beta-lactamase inhibitor, usually combined with the penicillin medication. This mechanism of action is that it blocks beta-lactamase enzymes produced by some bacteria, preventing them from breaking down the amoxicillin. This allows the amoxicillin to remain effective against broad range bacteria. And then the amoxicillin continues its mechanism of action using those PBPs and disrupting the bacterial cell wall synthesis. The pharmacokinetics are very similar to amoxicillin. It's rapidly absorbed, can be taken with food, which can help reduce some of the GI effects. We see this a little bit more with augmentin than we do with just the amoxicillin. It's distributed into a wide range of tissue, bodily fluid, the same as the amoxicillin is. Same thing with the elimination through the renal system, mostly through the urine, and has about the same half-life, 1 hour. For the pharmacodynamics, it exhibits time-dependent bactericidal activity. Its effectiveness depends on maintaining the drug concentration above the minimum inhibitory concentration, same as the amoxicillin. And the adequate portion of the dose for most of the interval of the dosing of the medication. It also broadens the amoxicillin spectrum by preventing the beta-lactamase mediated resistance. My prescription would be for Emily. I based it on if she was weighing around 135, with her being closer to an adult age and over a certain weight, there's usually a standard dose. So the weight isn't as important as if it was a younger pediatric patient, say a 4-year-old. Then we would really have to calculate the dose based on that patient's weight. For Emily, I said amoxicillin 500 milligram capsules. Take 1 capsule by mouth every 8 hours for 7 days. Complete the full course of therapy, even if you're starting to feel better. And you can take it with or without food. We're going to dispense 21 capsules, no refills. If symptoms are not improving after 48 to 72 hours, I want you to call back. I don't want to refill the same medication because we want to make sure we're effectively treating the ear infection. For drug interactions and adverse effects, specifically for amoxicillin, anticoagulants such as warfarin may increase bleeding. Oral contraceptives may make medication less effective. This I found there wasn't a significant amount of evidence, but it also discussed that having the GI adverse effects, where if you're having vomiting or diarrhea, then the effectiveness of the birth control can really go down. So we just want to advise using a second method, whether it's condoms or abstaining from sex during that time, just having that conversation with our female patients. And then for food interactions, amoxicillin can be taken with or without food. Taking the medication with food can help some of the GI adverse effects. Patients should hydrate well when taking the medication, especially if they're experiencing vomiting, diarrhea. We want to make sure we're really increasing our hydration, making sure that we're giving some supportive care to help fight this infection. Some common adverse effects are nausea, diarrhea, vomiting, skin irritation, abdominal cramping, and yeast. So we always want to make sure we can advise they can take a probiotic, they can have some yogurt. That can also help, but just being aware of some of those symptoms. Some severe symptoms are anaphylaxis, which can happen with any medication that maybe we haven't had in the past. So we always want to advise on what the signs and symptoms are of a severe allergic reaction and when to seek emergency care. Angioedema, C. diff, Stevens-Johnson syndrome, which isn't as common. And then you can have some hematological, like some anemia. These aren't really as common, some hepatic, some liver complications. Those are more rare and not what we usually see when taking this antibiotic. For monitoring, it does not, for Emily specifically, there is no lab monitoring that we need to do, no lab test. But if she had any renal impairments, any liver disease, then we would have to discuss further whether this was the right medication and whether we were going to do some lab tests or monitoring during the course of the medication. What we should advise Emily to do is monitor how her symptoms are, how she's feeling. And we want to advise that if symptoms do not improve within 2 to 4 days, that really 48 to 72-hour mark, we should see improvement, then she should contact the office. And we want her to come back in for a reevaluation, and then possibly we'll prescribe Augmentin if we feel like the ear infection isn't being treated, the otitis media needs something stronger. If Emily experiences any signs and symptoms, this is when we talk about the allergic reaction, facial swelling, trouble swallowing, difficulty breathing. We want her to seek emergency care and then also follow up with the provider. For non-pharmacological treatments and prevention, we want to talk about supportive care, maintaining adequate hydration. We want to rest. Our body, when we're fighting an infection, needs rest and time to just let our body handle to recuperate. And then we can also advise on taking probiotics, yogurts that contain active cultures that can help with some of the GI adverse effects if we're having any. Routine immunizations are great for helping prevent the flu, pneumococcal. We want to eliminate any smoke exposure. So especially with tobacco, even if it's secondhand, if you're not the one, if you're around secondhand smoking, we want to eliminate that. If you're having some discomfort, you can apply a warm compress to the outer side of the ear just for 10 to 15 minutes, just to provide some comfort. It will help with some of the pain. We can discuss if you have a lot of allergies. I know it said in Emily's history she didn't, but it's always something to bring up. And you're having chronic stuffy nose and congestion, that can affect having these ear infections. We just want to touch base and review that. We want to advise not to use any herbal drops, no ear candling, or putting any foreign objects in the infected ear or in ears in general until we discuss it with the provider. I know there's a lot of information out there, so we always want to make sure that we're just having conversations. If patients have questions or they want to try home remedies, we want to make sure that we're advising on what we feel is the best treatment for Emily. Patient education, we want to take the amoxicillin as prescribed and finish the full course of antibiotics. Even if symptoms start to improve, We want to make sure that there's no, if we stop too soon, that there's no antibiotic resistant bacteria that's then going to build. We want to take the full 7 days. And then, like we discussed, if we're not seeing improvement within that 48 to 72 hours, we want you to contact the office. That includes if the fever hasn't resolved, if we have ear drainage, if you feel like you're still muffled with loss of hearing, if we're not seeing any improvement, give us a call. And then again, for the allergic reaction signs, we want to call 911 if you feel like you're difficulty breathing, any facial swelling. You could always, if you're having questionable symptoms where it's a little bit more minor, where you're just having a tiny like itching in your throat, but you can always call the office and we can advise if we feel like you need to be seen immediately in the emergency room or what next steps might be. We have a 24-hour answering service with our triage team. These are my references. I'm going to leave the page up just for a little bit because there's quite a few. There's a lot of information out there on otitis media. This is something that in the primary care office that I work, we see very often. And we prescribe amoxicillin more often than not. We do see a lot of reoccurring infections, which then is a whole nother line of treatment. But overall, this is the case for Emily, and we hope that the amoxicillin would work and treat her otitis media. Hope you have a good day, and I look forward to seeing everybody else's presentations. Thank you.